Hello, everyone. I want to be the first to congratulate each and every one of you on your remarkable academic accomplishment today. Congratulations, graduates. I'm celebrating with each of you as you go on to great things as Rush healthcare professionals who will contribute in countless ways in hospitals, clinics, labs, and healthcare leadership settings all over the country. With all you have learned during your time at Rush University, you're empowered to make meaningful change in our healthcare system today and in the future. You now have the tools to improve healthcare, not simply one-on-one, but one-to-many. By that I mean that you have the knowledge and skills not only to care for patients one at a time, but also to help your communities and the public at large. As we have witnessed these past few months, healthcare is full of challenges. We've also witnessed how our Rush teams come together to address these challenges. Together, you will meet the challenges ahead, whatever they may be, and together you will solve them. You have what it takes. You are joining an elite group, Rush graduates, who lead wherever they go. We know this because other organizations repeatedly tell us about how different and how special our Rush graduates are. Of course, that's in part because of who you are. It's also because your Rush education, being so closely integrated with our health system, provided you with firsthand knowledge of the great promise and the challenges we face in healthcare. Challenges such as the inequities suffered by some of our less fortunate neighbors. Many of you have been inspired to address these inequities through your service in the community, and I thank you for your contributions. At Rush, you are immersed in a culture of teamwork. You learn to work across disciplines, to build partnerships, and sometimes to move outside your comfort zone in order to address complex health problems. You have a strong work ethic to get things done and a focus on achieving excellence. You came to Rush with an aptitude for health sciences and a commitment to care for people, but also a capacity to think broadly and inclusively about the health of populations, to embrace a social and professional responsibility, to act in ways that consider the well-being of all your fellow citizens. You discovered your voice during your time here. I've seen it. Whether in the classroom, the laboratory, or through a collaboration found on campus, you have demonstrated throughout your time here that you can adapt and grow as you have done so admirably, notably during the COVID-19 pandemic. You completed some of your education and training virtually. You demonstrated your values by volunteering to help support the community in countless ways. And you joined the front lines. You are our healthcare heroes, both now and in the future. Now, I'm calling on each of you to do even more. You're entering a world that has no playbook for what's next. Rush emerged as a leader during this crisis. You were here with us. There is no other group in society that possesses more knowledge, skill, and passion about health than you do. So I'm calling on you to use that knowledge, skill, and passion not only to become excellent health professionals, I'm confident you will do that. I'm asking you to go further. Each of you can play a role to change the future of healthcare for the better. You have the tools and power to make meaningful change in policy, in healthcare delivery, and in discovery. Use your voices as leaders to think and speak more broadly and inclusively about the health of populations and help us write the next chapter in American healthcare. This is your time to lead the way. Thank you for choosing to be a part of our Rush community. Again, congratulations to you on this accomplishment. Please know that even as you are transitioning to the next phase of your career, you will always have a lifelong home right here with Rush.